Morning with Amir. Hi friends, welcome to another video about the coronavirus. If you have not watched part 1 already, you may want to watch it first. Its link is in the description below. Did you ever wonder how a super tiny virus can make us sick? The coronavirus can only make us sick if it enters to our body from mouth and nose. When a single coronavirus enters our body, it looks for a suitable host cell, attaches to it, and then enters into it. It makes millions of copies before making the host cell burst and die. Those millions of tiny coronaviruses attach onto millions of host cells. They enter to them and make trillions of new copies. That is how fast they multiply and spread in the body, making us very sick. COVID-19 is the disease caused by the novel coronavirus. Among the symptoms of COVID-19 disease are cough, fever, sore throat, headache, muscle aches, shortness of breath, and in some cases loss of taste and smell and diarrhea. But not all people who contract the virus show symptoms. Many who show symptoms can recover at home. Like if I had the virus, I could just recover here. Those who have shortness of breath need to go to the hospital. They may need ventilators to survive. It can take up to 14 days for people to start showing symptoms after catching the virus. This is called the incubation period. Mostly elderly people or those with weak immune systems or those with chronic illnesses such as lungs and heart diseases and diabetes are more vulnerable and can get very seriously ill. Kids in general have not been seriously ill due to the coronavirus, but they can easily pass it on to others who may get seriously ill or even die. So kids must be very careful and try their best to not have it. It can even be dangerous for kids too. This virus has killed many young people. In the US, a 6-week-old baby and an infant have died of coronavirus. A 13-year-old boy in the UK, a 12-year-old girl in Belgium, and a 16-year-old girl in France have also died of COVID-19. Please press the red subscribe button to subscribe to my YouTube channel. The coronavirus is quite contagious. That means it can pass from one to another. It spreads more efficiently than a flu virus, but less efficiently than measles, which is highly contagious. A person infected by the coronavirus has trillions of tiny coronaviruses in their body. One here, one here, one here, one here, one here, until there's a trillion. Many are in their respiratory tract, nose, mouth, and throat. So from here to here, that's our respiratory system, upper respiratory system. Next is here. These viruses can go from an infected person to a healthy person in these following ways. The virus mostly spreads from person to person, close contact. For example, an infected person sneezes on their right hand. Then a healthy person shakes the hand of the infected person and later touches his or her mouth or nose. It can spread through contaminated surfaces. Like if someone sneezed on this with the tiny respiratory droplets of water with the virus inside, and then I touch them, and then I touch any part of my face, then the virus will get to me. But hopefully that's not real. A person with the coronavirus coughs on his or her hand and touches the doorknob. Then a healthy person touches the same doorknob with their hand and later touches his or her mouth or nose. Some studies suggest that coronaviruses can live on surfaces from few hours to days. According to a study, it can survive on copper for 4 hours, on cardboard for 24 hours, and on plastic and stainless steel, they can stay from 2 to 3 days. It is also spread by respiratory droplets. When an infected person talks, coughs, or sneezes, those droplets, those are the respiratory droplets with the virus inside of them. And then if someone inhales it, then it goes up to the mouth. It is also airborne. Airborne means that the thing that you talk about is airborne. It means it can stay in the air for a bit. A study suggests it can stay in the air for 3 hours. To avoid contracting the virus, you have to stop it from getting into your body from your mouth and nose.
Mouth and nose.
Nose and mouth. When you're outside, never touch your face. I know it's hard, but here is a tip. Always wear a mask when you're outside. It'll stop you from touching your face and it'll stop the virus from getting. Wash your hands with soap for 20 seconds as often as you can when you're out. And definitely as soon as you come home from outside. When you're outside and you don't have soap and water, hand sanitizer that adds 60% alcohol and more can help. But soap is the best. The virus of the envelope.
The virus of the envelope.
The envelope of the virus is made up of fat, and the soap removes all that fat, and then the virus will have no protection and stuff and will just eventually die. Avoid touching things by hand. If there's something you have to do with in public places, like if you have to open the door, turn on lights, always use your elbow to do stuff, but of course not eating food with elbows.
Okay.
But you have to wash hands, otherwise you'll have to do it. Avoid gatherings and handshaking. Practice social distancing, which means stay at least 6 feet away from other people when you are outside. When outside, wear a mask. A cloth mask with a filter is fine. Surgical and N95 masks should be worn by doctors and nurses. An N95 mask may look like a round of foam like this with straps. Those infected with the virus should also wear a surgical mask. Cloth mask can be easily made at home. Here is a cloth mask that my mommy made for me. It has a pocket for a filter, and it has long strips, not elastic, because elastic sometimes hurts people's ears. And anyway, we're already made a video if you can watch with detailed instructions how to make this. The link of the video with detailed instructions is in the description box below. It also has a free pattern. Now I'm wearing the mask and ready to go outside. Just changing my shoe. On high hills, I like to run down on high hills. It's my favorite sport.
Okay, good.
Okay. We're just waiting. Just in case. Now I'm gonna go show you how you do stuff in the bathroom after you come back. Oh, sorry, not too much. Foam is coming. And actually foam is everything, it kills. Mommy said. Now?
Okay. All parts?
Thumb, fingers, between fingers.
Yeah.
If you have contracted the virus or doubt or think you may have, isolate yourself and stay in your room. Like actually this room you're filming in is actually my new room. If possible, other people should not use your toilet or dishes. And disinfect everything carefully if they share restroom with you or touch your dishes. You should wear a surgical mask around others, and the others around you should also wear mask. If you have shortness of breath, you should go to the emergency room in the closest hospital immediately. For other symptoms, be in contact with your doctor on phone, computer, tablet, or any screen on the internet. Most people recover from COVID-19 on their own. Unless you have shortness of breath, your doctor will likely tell you to stay home, take a lot of rest, and drink a lot of water. It takes about 14 days to recover from COVID-19, also known as 2 weeks. Those who have shortness of breath may need ventilators to survive. Ventilators are breathing machines that help a person to breathe. They blow air into the lungs and help maintain proper levels of oxygen into the blood. They're expensive machines and there are not too many in hospitals, especially in countries which are not rich. Even if you're not sick, you should always practice good habits. When you cough and sneeze, do that in a tissue paper. Throw the paper in the bin right away. And carefully wash your hands with soap. If you don't have a tissue paper, cough and sneeze in the inside of your elbow. Like here. Ah! Like I did in the other part those 2 to 3 times. Ah! Actually, that's what I just did is one way to prevent respiratory droplets from getting into other people. Wash your hands thoroughly and wash your hands with soap. You can be sure that you contracted the coronavirus if you get tested for it. If you test negative, means you're still normal. No coronaviruses multiplying in your body. But if it's positive, you then have the virus. And testing is limited and expensive. It is not available for everyone everywhere. If you develop symptoms such as cough and fever, you may have contracted the virus. You should isolate yourself and stay away from others, and you should watch your symptoms for 14 days. On the first day I have, second day, third day, but 14th day it may go away. As of now, there is no proven cure of coronavirus through medication. Only your body can fight it and get rid of it on its own. Some existing medicines and plasma from patients cured from COVID-19 have shown some promising results. but clinical trials are underway to establish if they are safe and effective before they can be prescribed for all COVID-19 patients. Vaccines are like fake viruses. They have the structure of the virus but are harmless. They train the body to fight a real virus when it enters a body. As of now, there is no vaccine for coronavirus. Many scientists and doctors are working hard to create a vaccine. It will take more than a year for a vaccine to be available. Your body fights the virus. It is a war between the virus and the body's fighting system called the immune system. If the virus wins the war, the patient dies, and the cases happen when they're still fighting. In most cases, the body can be able to overcome the virus and just get rid of it. Vaccines can help train the immune system before it has contracted the virus. But we don't have a vaccine yet. Antiviral drugs can help kill the virus, but we don't have any antiviral drug for the coronavirus yet. So for now, it is just our immune system against the virus. People with weak immune systems and those suffering from chronic diseases find it hard to fight the virus, and they are vulnerable to serious illness and death. Since the coronavirus has already spread throughout the world, unfortunately, it can't be contained. Most of the people in the world will get exposed to it in the coming months and will develop immunity against it. If scientists are able to find a vaccine or an antiviral drug, it would definitely help. But over time, due to mutations, which are changes in a genetic material, the virus will become weaker. Experts think that in the next 5 years, it will become as normal to us as a flu virus, and most people will only get mild symptoms from it. For some with weaker immunity, it would still remain dangerous, just as flu virus is dangerous for some people and causes many deaths around the world each year. In part 3, we will look at the major deadly outbreaks of contagious diseases and compare the mortality rate of SARS-CoV-2 with SARS and MERS coronaviruses. We will learn to create pie charts, column graphs, and scatter plots. Finally, we will use the graphs to understand how the virus has spread over the weeks and how many deaths it has caused. In the meantime, please check out other videos on my channel. You might want to learn how to play chess, grow plants in water, and make your own calendar. You can learn about the globe and map of the USA. If you like to read or listen to stories, you might like my reading videos, such as The Lion King, which is my favorite. If you are young or have younger siblings, I have videos about alphabets, numbers, shapes, and colors. If you like animals, you can learn about the Arctic animals and see pets doing amazing tricks. If you like to make crafts, you might want to watch my videos about crafts. Finally, if you like shows, I have videos of some wonderful shows that you might want to check out. Thanks for watching. Hope you enjoyed the video. Stay healthy, stay safe. Don't spread the coronavirus, but spread this video about the coronavirus. Please like and share this video. Please subscribe to my channel Learning with Amir. And follow me on Facebook and